It is not looking good for you, Donald. Seriously, maybe you need to check into a hospital again or something. I mean, the discolored hands, the massively swollen ankles, the fact that you can't walk in a straight line, the fact that it is obvious to anybody watching you just how cognitively addled you are. Nobody's buying that your hand looks that way because you shake a lot of hands. That's not a thing. No one believes that you had an MRI done just of your abdomen for preventative reasons. That's not a thing. Nobody believes that the reason that you continue to get cognitive exams is because you just love acing them. No, something is seriously wrong with you. I mean, we know that, but at a deeper level, this cognitive deterioration, it resembles, I'm just sharing with you my opinion, let me be clear, as I'm entitled to under the First Amendment, what happened with Donald Trump's father, Fred, right around Donald Trump's age, right around that 79, 80 years old, where he had devastating Alzheimer's and it rapidly accelerated until he passed away a few years later, and he took all these cognitive exams and he couldn't draw the photo of the clock, and the family covered it up and they created a fake office for Fred so he could pretend that he was working and that he would show up to the fake office every day. I mean, this is what it at least looks like to me. That speech that Donald Trump gave in North Carolina on Friday night, again, it is scary. And it is scary because this truly sick individual, I mean, he is a sick person, but he's also, in my opinion, actually very sick right now. And it's being covered up. This guy has access to the nuclear codes. He's making life or death decisions, war and peace decisions, and they're all going in the bad direction. And the guy is a cognitively addled mess. I mean, again, you saw when he was with Putin and he rolled out the red carpet, he couldn't walk in a straight line when the Japanese prime minister had to chaperone him. But let's just go Friday night. Go to Friday night. He's in North Carolina. It's this teeny tiny crowd that they're creating for him. Kind of reminds you of creating a fake office for Fred, right? He goes to his little office. He goes to his little rally. Remember the one he did 2 weeks ago in Pennsylvania, right at Mount Airy Casino? Same thing, like 150 people. Like they're creating for him something to give him comfort, right? They put him in this North Carolina, small venue. And then Donald Trump's just like, I got perfect health, everybody. This is supposed to be a speech about the economy. And I suppose he was trying to attack the Democratic candidate for senator, former Governor Cooper, interviewed on the MeidasTouch network. But Donald Trump's like, I've got perfect health, everybody. What the hell? I mean, seriously, what is this? What is this? Here, play this clip.
They'd say, there's something wrong, but I like to do it. But I had perfect health. And they reported his health is perfect. And they interpret that. And the fake news interprets when the doctor says he's got perfect health, they go, what does he mean by perfect? There's something wrong with the president. These people are sick.
And then in front of this teeny tiny North Carolina crowd, he's like, there will be a time when I won't be 100%, but I'm 100% now. Here, play this clip.
Now, there will be a time when perhaps it won't be 100% true with all of us, right? And when that time comes, I will let you know about it. In fact, you'll probably find out about it just by watching. But that time is not now, because I feel the same that I felt for 50 years. I really do.
Then he talks about acing the cognitive exams. I've aced it. I mean, if you look in the background, there's a sign that says lower prices. Because I guess the speech was supposed to be about lowering prices, even though prices are surging right now. But he's talking about he aced 3 cognitive exams. Here, play this clip.
But I've taken now 3 cognitive tests. I've aced every single one of them. And And these are, that big stuff. This is Walter Reed. I've got a whole team of doctors all over the place.
On the MeidasTouch Network, we come with receipts always. So I've interviewed Dr. Vin Gupta, who runs MeidasTouch Health. I'm sure you've watched Meidas Health before. And I asked him, I said, okay, well, Donald Trump's saying he got a preventative abdominal MRI. There's no such thing as a preventative abdominal MRI. You would get it to the extent you get a preventative one, which is not usually what happens. But let's say you're getting an executive preventative MRI. You get the brain also. You don't just do it in the abdomen. That's that never happens. Okay. It never ever happens. Let's be very clear. Saying that your hand looks that way because of handshakes and you taking cognitive exams all this time. Here's what Dr. Gupta told me. Play this clip.
So number one, advanced imaging, you do not get out of nowhere just an MRI of your torso, your chest, and your abdomen and present those results from the White House physician and act as though that's a normal screening tool. There are some that believe that a full body MRI in this day and age, if you can afford it, is appropriate to do. Reasonable people can disagree. If that's what actually he did, then present the results of the full body MRI. But there's no reason whatsoever, especially if they're saying he's the chief executive of the United States, just to limit it to the MRI of the chest and the abdomen. Nonsensical. Number two, at the Montreal cognitive assessment, this tool to assess whether or not you have early signs of dementia through understanding whether or not you can recall 4 words, very basic type of test. This is not something that you repeat frequently unless there's a neurologic reason to do so. If there was a neurologic reason to do so, fine. In certain cases, you repeat the test. But if you're otherwise claiming to be normal, you're not repeating the Montreal cognitive assessment as often as he's claiming to do it, as though that's some sort of flex here. It's not. And I think he's being misdirected, or he's just reading something and is being misinformed by himself. And then 3, lastly, just the fact that how he presents himself, whether it's the hand, is there something happening with that hand? Is there an IV there that they're trying to cover up? His pressurized, rambling, incoherent speech. When you take it all together, reasonable people are asking reasonable questions. These are not political questions. These are basic medical questions that if they had a doctor that was not trying to editorialize and actually just present the facts, these would be reasonable questions to get answers to, and yet we're not seeing that.
And then you'll see in the speech, Donald Trump does something called disinhibition, which is something that in dementia patients and Alzheimer's patients, he's thinking of very sexualized things that he's blurting them out. And so he's like, her undergarments, her panties. I think he's talking about Melania's underwear. That when the FBI searched Mar-a-Lago, I don't know what he's even trying to say here, but he's like, she's got beautiful panties. Again, this is supposed to be a speech about the economy in North Carolina, a state that Donald Trump attacks. Here, play this clip.
But everything is perfect. Her undergarments, I want to use a nice, sometimes referred to as panties, are folded, perfect, wrapped. They're like so perfect. I said, that's beautiful. It's the part of the world she came from. Everything was perfect, no problem. Fold, fold, fold. I think that she steams them, make sure. Just that it.
And then Donald Trump's like, I don't care what women look like anymore. A beautiful woman could walk right by me and I won't call her. Okay, what the hell? Here, play this clip.
I'm a very aesthetic person, believe me. Except with women. I don't care what a woman looks like. I used to say beautiful, and now I don't care. Since politics, I never mention looks anymore. The most beautiful woman can walk right across there. I don't even look at her anymore. Because in politics, that's the sign of death. We don't look. But I do look at the arm of a chair, and I'd say to your artists, they were artists. They were artisans,
Then his speech, this pressurized speech that we've been talking about, if you've been following our coverage on his deteriorating health, is they're totally beholden. They're totally beholden. That's this pressurized speech that you see. And he's exhibiting these signs that doctors would tell you is what. Here, play this clip.
Because they are totally beholden. I don't love that word, but they're beholden. They're beholden to the insurance companies.
Then he goes more about bragging about cognitive exams. I took this cognitive exam. By the way, not easy. Not easy. You gotta identify a hippopotamus. Not easy. You gotta say that that's a hippo and that's a lion. This is what he's talking about. His whole speech was like this. His whole speech was like this. Here, play this clip.
First day in 28 days, these people are sick. That's why I've taken more physicals, because I think you have an obligation to, report. And I hate when they put out false reports. So they put out a report that Donald Trump. So I took a lot of physicals. And I did something no other president's ever done. I took cognitive tests. Because I know that, and by the way, not easy. You get to those last questions, those last 10, 15 questions, nobody on that stand could answer probably any of them. And I got them, I aced them. And no other president's taken a cognitive. Could you imagine Sleepy Joe taking a cognitive test? I don't think he'd get the first question is like, what is this? And they show a lion, a giraffe, a fish, and a hippopotamus, right? And they say, which is the giraffe? So that's the only question. But what happens is it then gets harder. I don't think Joe would have gotten the first question right. He would say hippo. I want the hippo. But anyway, I've taken now 3 cognitive tests. I've aced every single one of them. And
then he brags about stealing $1 billion from the Treasury for himself and doing a deal with himself to steal $1 billion in taxpayer money. Here, play this clip.
Donald Trump sues the United States of America. Donald Trump becomes president, and now Donald Trump has to settle the suit. I hereby give myself $1 billion. Actually, maybe I shouldn't give it to charity. Maybe I should keep the money. No, a lot of people say, do it. No, I don't want to do it. But whatever happens, it's all going to good charities. Is that okay? It's all going to good charities. But isn't that a strange position to be in? I've got to make a deal. I negotiate with myself.
When he's got the state regime propaganda network, they've attacked my brother Jordy when Jordy called out some of these excuses. You saw when Fox did this to Jordy. Play this clip.
Caroline Levitt says the president had bandages on his hand because he shakes too many hands. Well, the guys on the MeidasTouch leftist podcast had an issue with that. Watch.
Donald Trump has all of those bruises and bandages because he's out there literally shaking so many hands. I mean, you simple-minded people, you guys can't even fathom the amount of hands he's out there shaking. And look, this is why I say at a certain point, I don't even believe what we're doing here is political. Plain and simple, I just don't want to be lied to and I don't want to be gaslit.
The funniest part, he went on to say that the bandages on the hands were some kind of weird, wacky disease, theory? Like, he had something and it was some zombie-ish thing. Yeah, of course.
In the words of my 12-year-old, bruh, you don't want to be lied to? Where were you when we were being lied to about Joe Biden's actual mental state and all of the people puppeteering him like he was a Muppet? Like, seriously, maybe... That doesn't look suspicious to me at all. Having worked with a lot of A-list talent that are actually out there shaking a lot of hands, this isn't surprising. I mean, the guy's an elderly man. Your skin gets thinner as you get older. At least he has the mental capacity to run the United States and run it better than Joe Biden did.
And then they had Caroline Levitt out there saying, as for the bandages, the reason that Donald Trump's got bandages on his hand is he shakes these hands all the time. Here, play this clip.
The president's been spotted out and about a number of times with bandages on his hands. Could you please explain what that is about? Secondly, he noted on Truth Social the other day that he had aced 3 cognitive tests. Could you please clarify when those tests took place?
I can do that at a later date. I obviously don't have that in front of me. The president has spoken about that quite extensively throughout the years. As for the bandages on the hand, we've also given you an explanation for that in the past. The president is literally constantly shaking hands. The Oval Office is like Grand Central Terminal. He is meeting with more people than any of you even know about on a daily basis. He's also on on a daily aspirin regimen, which is something his physical examinations has said in the past as well, which can contribute to that bruising that you see.
You judge for yourself, but I think this guy needs to get serious medical help immediately. I'm giving you I think the guy needs to go to a hospital, or he needs to go back to Walter Reed, and there needs to be the 25th Amendment. There absolutely needs to be the 25th Amendment right now. If there is ever a need for it, it's right now. Hit subscribe. Let's get to 6 million.
Thanks for watching. Be sure to add the MeidasTouch podcast on Apple Podcasts, Spotify, or wherever you get your podcasts for new updates every single day.